healthcare should not be a privilege. It should be a right. That we're not going to deprive anybody, certainly not someone who's working in California, a right to access the healthcare that they need. No one who works should have to fear taking their child to the hospital because they may not be able to make the mortgage payment or the rent payment. That is not peace of mind. And so, first and foremost, we have to continue on this trajectory to get California to the point where no family has to worry that they'll have access to the care that they or their children need. That's the first thing. So quite honestly, I will tell you, given what we're seeing happen in Washington, D.C. with this reconciliation bill that just became law that's going to actually kick people off of their health care in California and throughout the country, that's going to make it more expensive to keep the health insurance, that's going in the opposite direction. But if I'm governor, we're not going backwards, because we have to make it so that everyone can have access to that care they need, not just for the peace of mind it gives a family. But think about it this way, Chief. If you're that hospital, especially if you're a hospital in a rural part of California where it's really tough to make a go of it, if you're a hospital and all of a sudden a good portion of the people that are coming to your hospital are no longer coming with Medi-Cal or Medicare or their own health insurance through the Affordable Care Act or just their own insurance, they're still coming to the hospital.
Right.
Except now they don't come with payment.
Right.
Because they can't afford to stay without insurance. And
the hospital's still going to serve them.
The hospital still is required to give them service. So guess what happens? Either those hospitals go under, and that's why you're hearing today, as a result of the Washington reconciliation bill that President Trump sought and got, a lot of rural health facilities are now in danger because they no longer will have as many paying customers, and they're going to have to absorb that. Either that, or they pass along the cost of those uninsured to those people who are insured. So the hospitals charge the insurance companies more, and the insurance companies then charge you as their customers more to keep your insurance. So one way or the other, we're going to give people care. The worst thing we can do is make it care that the hospitals and doctors are going to offer it don't get paid for. And because people can't afford it, they wait till the last moment, which means they use the emergency room, which is the most expensive form of healthcare you can get. And again, we end up paying for it.